Dear Manish, dear Committee of Scientific Affairs and Awards, dear Respite Society, I'm very grateful that I received this prestigious award, and I'm pleased to present some results of my research during the last 5 years about diagnosis, clinical features, and pathogenesis of Mycoplasma pneumonia infection. I have nothing to disclose. Mycoplasma pneumonia is a major cause of CAP in children. Current diagnostic tests, including PCR and serology, do not reliably differentiate between Mycoplasma infection and carriage. Based on our findings on the essential role of B cells for clearance of Mycoplasma from the lungs in mice, we aim to evaluate the measurement of circulating antibody-secreting cells by enzyme-linked immunospot assay as a new test for diagnosing Mycoplasma CAP in children. This project was made possible by an ESPID Fellowship Award. In an observational study, we were able to show that the measurement of specific antibody-secreting cells improves the diagnosis of Mycoplasma CAP. Mycoplasma DNA and IgM antibodies could be detected in both CAP patients and healthy control asymptomatic children. But only the detection of IgM antibody-secreting cells allow the differentiation between infection and carriage. In a longitudinal cohort of this study, we were able to demonstrate and show why IgM antibody-secreting cells may be an optimal resource for determining disease etiology in Mycoplasma CAP. Antibody-secreting cells are short-lived and associated with disease, in contrast to Mycoplasma DNA and IgM antibodies that persist for months and are also present during carriage. The more precise diagnosis with the antibody-secreting cell ELISpot allowed also to identify clinical features and biomarkers that predict Mycoplasma CAP in children. Age above 5 years, respiratory symptom and fever duration of more than 6 days, no underlying disease, family with respiratory symptoms, and prior antibiotic treatment, as well as a procalcitonin level below 0.25 were strongly associated with Mycoplasma CAP. We also showed that 1 out of 4 patients with Mycoplasma CAP developed mucocutaneous disease, such as Mycoplasma-induced rash and mucositis, maculopapular skin eruptions, and urticaria. Mycoplasma-induced mucocutaneous disease was associated with increased systemic inflammation, morbidity, and a higher risk of long-term sequelae. A correct diagnosis of Mycoplasma infection with the antibody-secreting cell ELISpot was also the basis for investigating an association between Mycoplasma genotypes and specific clinical outcomes. Our results suggest that Mycoplasma genotypes may not determine specific clinical outcomes. These results are shown in the ESPID oral presentation session 1, bacterial infection. These findings further suggest that host factors determine which children exposed to Mycoplasma are more likely to develop CAP, extrapulmonary manifestations, or carriage. We were able to identify CD4 positive effector memory T cells as the major population of the pathogen-specific interferon gamma response in children with Mycoplasma CAP. The presence of these Th1 cells in peripheral blood correlated with pulmonary disease severity. In conclusion, our studies show a combination of clinical features and biomarkers may aid physicians in identifying patients at high risk for Mycoplasma CAP. Mycoplasma-specific antibody-secreting cells are short-lived and associated with clinical disease, making it an optimal resource for determining Mycoplasma pneumonia etiology. And finally, Th1-mediated immunity may be involved in the pathogenesis of Mycoplasma cap and mucocutaneous disease. I would like to thank ESPID for all the support during these years, and my highly esteemed mentors Christoph Berger and Anna-Marie van Rossum, Elena Panisova for her support in the lab. It was a collaborative effort that would not have been possible with all the collaborators, the funders, and all the children and their parents who contributed to these studies. Thank you so much.